Hi there. This video is about how our systems process home blood pressure readings. On a test patient, we're going to launch the recall overview. And once your practice is ready to use it, this button here, Home BP Readings, should be live and ready to go. Now, the first thing it's going to ask is, have we got a minimum of 8 readings over 4 days? If we haven't, then that's not enough to record it, and we're going to need to go back to the patient to ask for more readings. But we're going to put yes, and I'll show you how we then proceed. So here we've got the average home BP and pulse template. Don't come straight to this, you need to launch it via the protocol. And we're going to launch our average home BP calculator. Now, you'll need this setting up for your practice if you want to use it. This is a calculator we've developed. It does various checks and things as you go along. So if I were to kind of change that to a really low reading, it would flag that up. Or if it was not necessarily that low, but lower than the diastolic, again, it would flag that up. So it's worked out all the averages just to make sure this test patient gets coded as needing possible hypertension. I'm just going to whack up some of these. Don't do that in real life. But you can see, look, now we're at 129.86, and we'll see in a minute that that is over the patient's target. So I can do Control-C, Control-V into there. The target, by the way, you can see is 140.90, but that's for a clinic BP. For a home BP, you can take 5 off each reading. So this is above target for this patient. Average pulse is 76. And then we want to also paste the BP readings in. So again, select that, Control and C, Control and V. If the pulse is really low, just to show you this, it will then ask you to record and paste in the pulse readings. If it's below 50, it will do that, or if it's high. So if it's above 100, it will do that. Most of the time, though, that's not necessary. Let's put that back to what it was. So if I OK that, the protocol will now start to do its thing, and it will compare the average we've just coded against what's in the patient's notes, what they require. And it will look at things like, have they got hypertension diagnosed already? If they have, are they on medication? Could those doses be increased? It will check the pulse if it's over 100 or below 50. It will also check for low blood pressure, i.e. hypotension, and flag that. So we can see here the BP readings are above target and suggest a hypertension diagnosis. 2 options: I can either send the letter now via comms annex, or leave it for the report. So leaving for the report is basically we'll drop into one of our clinical reports where someone in your practice should be regularly running those. To show you how it works though, we'll do the letter now. The letter is going to put in what their target is, what their actual is, and then also some of the tests that they now need. So your average blood pressure is 129.86. It should be below 135.85, so it's not vastly raised, but it is raised. And these are the following tests they need. It's also going to give them some advice in the meantime, and it says, please call us to arrange the test that you require. So if I save that, in this view that's also popped up there, there's some steps here, and what we can do if we want to is send via comms annex. And we have done a preset about letter attached. You can search for that. There we go. It might be that you want to do a bit more information in there, but basically the letter is pretty self-explanatory and has all that you need and all that they need. As we send it, it's also going to add various codes to say that we're inviting them. And if we had in real life saved the record, the patient had booked in a few weeks later, when you come into the recall overview, it will then show the things that are needed. I can kind of show you how that looks by re-evaluating these alerts. And you should see ECG and urine ACR appear. Yeah, there we go. And also the fact there's possible hypertension, and explains a bit more there. Once those tests are complete, they then drop into the next stage, which is to generally confirm hypertension and go from there. If we just want to look briefly in the journal, You can see clearly the readings. They're pretty easy to review. That's mainly if a clinician wants to look and see, is there one or two spurious readings that's really skewing the whole lot. You can see kind of average pulses in range. That's fine. The target is this because they're under 80 in this occasion. The home readings are above target, and now these tests are required. So, like with our other protocols, it's kind of documenting everything as it goes along. It's coded suspected hypertension, and that's all you need to do. There are obviously other outcomes, and the system will tell you what to do, and it's trying to be self-explanatory. Hopefully, it's not too difficult to follow. In a separate video, we'll look at what it means to actually run the system and what things are needed there. Thanks.